We have now done over 350 mobile vaccination clinics as a collaborative. I think we're up to 50,000, over 50,000 vaccinations in Orange County. The most vulnerable community members were older adults. A lot of them were monolingual, and they wanted the community to access an app that was only in English, and they also had limited resources to provide translation when they called in to get an appointment. So although they prioritized the community that was most vulnerable, they really did not provide any access.
Thực sự là người Việt Nam của chúng ta nói chung và các bác cao niên nói riêng, một cái khó khăn đó là cái cản trở về mặt ngôn ngữ.
We sat down and we just kind of like talk and say and learn from each other. Okay, what do we do during this time? What program can we come up with? What are the needs? Like, what is our community member needs?
It was on a phone call. It was actually with some of my partners who turned out to my friends, who I consider my sisters now. And it was Katie Tran from Hope, and it was Sister Tui from St. Joseph. And I was on that phone call because we were discussing what are we going to do in this situation? The seniors are dying. And lo and behold, I looked and I was getting a call from Dr. Clayton Chow, in which I've never spoken to him on the phone. And I picked up at the encouragement of my friends, and he said, Jennifer, I want you to host a vaccine clinic tomorrow. At the end of that phone call, we said we were going to move forward. Saturday, that was a Friday afternoon, so Saturday they came and did a site visit in which we got together adjacent to our building in this parking lot, and we decided how we're going to vaccinate the very first mobile clinic.
After that first clinic, our life completely changed. All of us at Hope and also our partner organization for 6 months, I think we work every day.
Because of the emergency order, we didn't have to go through the typical bureaucracy process that government entity has, which take a long time, right? So because it's under the emergency order, I, as the health officer, have the authority to do whatever it takes, whatever is necessary, quickly to galvanize and to gather all the community-based organization and to work together. You've got Latinx community CBO, work with the Asian CBO, and we were just all there. We just crossed the border and we served. Right? Our intention is serve the vulnerable senior.
And we started calling people. We called about 8,000 persons in at least 2-3 months. I think we helped to fill the application for the transportation. They can be picked up for their home, going to the vaccine site and back to the houses, right? And okay, I cannot speak English, so okay, don't worry, we can go over there and translate for them, to English.
So we were able to overcome those challenges by having staff and volunteers that speak the language. When people see somebody that they can familiarize themselves with, they feel more comfortable coming to the vaccination clinic. We were also just gaining their trust through showing up to the place that they were. They pray, they work, they gather.
At the beginning, we went with them to the site and showed this, you can get the vaccine. Nobody here, no police, nothing. So, and they think that when they pass the voice to their Latino communities, when the undocumented people start coming to the vaccines. Also, they think, oh, I don't have paper, I don't have insurance. And I say, no, it's free. You don't worry, you have to pay nothing. It's free transportation, it's free everything. We will be there for you.
Yes, we had special clinics, remember at the healthcare agency. Is we provided clinics at their Pride events. We make sure that they're invited, they're a part of it, and that the community sees that we're all united and working together, and we're not going to exclude anyone.
I think the pandemic really highlighted and brought to the forefront a lot of issues that have been ongoing for years in the community, and issues of lack of access to healthcare, or what I would say quality healthcare, lack of access to transportation, education, livable wages, and all of those created what we call the social determinants of health, right? And we saw that people of color, Black and brown people, are disproportionately impacted by negative COVID outcomes.
We're not just here working in a silo. The public agency can support us with resources, information that CBO don't have, and CBO can be that trusted partner to share those services, to share those resources, so it goes to those that actually need it the most.
Right, and I remember that there would be flyer from the county say, senior, it's your turn to get the vaccine, please come to this website. Nobody go, right? But when the CBO, the community CBO, the NPO go to the neighborhood and say, come out and do the neighborhood, they came out and do the neighborhood because they trust their entity. And I think that it would be an unfortunate if the public does forward, because there's values of this public-private relationship, and move forward, because there's a lot more work need to be done.
The Office of Community Partnerships and Strategic Communications intentionally listen to communities to help us accomplish our goals. When we talk about trust and trusted messengers, we at the state also hope to develop trusted relationships to effectively reach our diverse communities in California.
The challenge is that how do we make sure that the work of health equity is not because it's popular right now, or it's not because it's a requirement from the state or from the federal government, but we're doing it because we recognize that if we don't do it, our communities are going to suffer and die as a result, right? And so how do we do it? Because it's a value, right? And it's a moral and ethical conviction rather than it's a requirement, right? And it's a checkbox.